हेलो फ्रेंड्स, हम बहुत ही इम्पॉर्टेंट टॉपिक पे बात करेंगे कि मसल इन्वेजिव ब्लैडर कैंसर के बाद में जब रेडिकल सिस्टेक्टमी करते हैं और न्यू ब्लैडर बनाते हैं तो ये पेशेंट्स कैसे अपना जीवन बिताते हैं, किन किन चीज़ों का उनको ध्यान रखना चाहिए, ये सभी क्वेश्चंस का हम आज इस वीडियो में आपको इन्फॉर्मेशन देंगे। जब भी हम लोग न्यू ब्लैडर बनाते हैं, सबसे पहले द मोस्ट कॉमन जो टाइप ऑफ न्यू ब्लैडर बनता है वो है स्टूडर न्यू ब्लैडर। अप्रोच चाहे ओपन हो चाहे रोबोटिक हो, इंटरनली सर्जरी जो है वो सिमिलर वे में की जाती है। जब भी पेशेंट मेरे पास एडमिटेड होता है आफ्टर द सर्जरी, सो द मोस्ट इम्पॉर्टेंट थिंग फॉर अस टू नो कि आपका जो ब्लैडर बनाया हुआ है वेदर इट हैज़ हील्ड प्रॉपरली और नॉट। सो ये जर्नी जो स्टार्ट होता है राइट आफ्टर द सिस्टेक्टमी, what we see that if the bladder is healed properly, so हम अराउंड 3 वीक्स टाइम पे इस ब्लैडर को चेक करते हैं आफ्टर डूइंग सर्टेन एक्सरेज कि आपका ब्लैडर प्रॉपरली हील हो गया कि नहीं हो गया। सो ड्यूरिंग दिस पीरियड ख़ास तरह का इशू रहता है न्यू ब्लैडर में कि बिकॉज दिस ब्लैडर इज़ मेड फ्रॉम द इंटेस्टाइन्स, सो देयर इज़ लॉट ऑफ म्यूकस, यानी कि एक वाइट फ्लेक्स से सिक्रीट होते हैं विच इज़ अ नेचुरल सिक्रीशंस ऑफ द इंटेस्टाइन्स। वी कॉल इट एज ए म्यूकस सिक्रीशन। सो वो म्यूकस को वी हैव टू वॉश। सो एटलीस्ट इनिशियली 3-4 वीक्स के लिए हमें अल्टरनेट डे ट्वाइस इन ए वीक वी हैव टू वॉश ऑल दोज फ्लेक्स। अदरवाइज क्या होता है कि यूरिन की कैथेटर्स दे गेट ब्लॉक्ड। सो वी हैव टू कीप ऑन वॉशिंग एंड एट द सेम टाइम वी गिव सर्टन मेडिकेशंस टू दीज पेशेंट्स so that the mucus becomes thinner and thinner and it get washed into the catheter, does not get blocked. So this is one challenge obviously for the healthcare provider to keep washing it on a regular basis and also for the patient as well. So after 3 weeks we start actually taking out the catheters. So अंदर की जो splints होते हैं they comes out, your suprapubic comes out, and then we take out the urethral catheters as well. So now once we have taken out all the catheters, then bladder में urine जो है इकट्ठा होना शुरू होता है. We call it say now priming of the bladder or functional bladder has started. Now once we have started this, many times patient does not have a full control of the urine. So वो उनको क्या होता है कि urine जो है वो leak होता है in the diaper, so they keep on wearing the diapers for some time. But slowly maybe in 2 to 3 weeks time they regain their continence, and then now the bladder start filling. Once the bladder start filling and holding the urine, and then patient feel heaviness, that in lower abdomen there is some heaviness is already feeling. That means it's a filling pressure which is being exerted on the bladder. So they feel, and once they feel, they go to the washroom, and what they do, they just put 2 hands on the abdomen. We call that as a Creed maneuver, and they just put a little bit constant pressure and pressing it downward, and at the same time relaxing the perineal muscle. So by this coordinated act, the bladder empties completely initially. So in initial 6 months, the patient really gets sometimes confused how to deal with this patient, but how to deal with this bladder. But however, it's a slow learning process for them also, because it's a new organ which is created by us from the intestine. So it's not a natural bladder. You will not have that exactly the same sensation. However, you mimic those sensations and you learn with the passage of time how to deal with this. The second problem which happens in less than 5% of the individuals, that sometimes you are not able to pass the urine properly, and in those scenarios we advise them to pass a small tube through the urethra to empty the bladder. And with the passage of time they also understand how to relax their perineal muscles and then pass the urine. So this is one part, that the patient has to regularly wash the bladder and take medications on the regular basis, keep themselves well hydrated so that urine get flushed again and again. Another very important issue which comes up with these patients is that nocturnal enuresis. बहुत बार देखा गया है कि ये पेशेंट जो न्यू ब्लैडर वाले हैं डे टाइम में तो बिल्कुल ड्राई होते हैं, लेकिन शाम के समय दे मे रिक्वायर the pampers or the diapers to keep themselves dry. So this is because during the night there's a lot many urine formation when we lie down. Also the bowel also has some overactivity in the initial months of the bladder formation. So slowly this also resolve with the time. The last but not the least, which is most important for these patients, is that they can suffer recurrent urine infection after the bladder reconstruction. The reason is that we join the urinary tube directly into the bowel, and flora is totally, getting contaminated. You may have a reflux into the kidneys of urine, and that can lead to the infection. Sometimes you are not able to empty. There's some residual urine, which is a source of infection as well. And a long-term basis, these patients can have stone formation, because अगर आपने mucus को अच्छे से साफ नहीं किया हुआ है, this mucus could be one source, along with the bacteria can form the stones as well. Overall, it has been seen that ileal conduit and the new bladder, over a period of 5 years follow-up, both of these set of patients are happy in their own capacity, whether it is a new bladder or it is a ileal conduit. However, when it comes to the confidence levels, the body image, the bladder formation, that new bladder formation is always has a superior hand compared to the ileal conduit. So I hope that anyone of you is having a new bladder, or anyone near to you has a new bladder, this video will definitely be useful for you. Thank you very much for watching this.